Ever wondered how AI could help doctors spot mental health issues faster? Let's unravel a groundbreaking study that's using machine learning to distinguish between two complex conditions: anxiety disorders and adjustment disorders. Think of it like a detective game, same symptoms, different clues. Here's the challenge: anxiety can manifest in countless ways. Is it a persistent, unexplained worry, like an anxiety disorder, or a reaction to a specific stressor, like a breakup or job loss, adjustment disorder? Doctors rely on clinical notes, those detailed patient records, but sifting through them is like decoding a secret language. That's where AI steps in. Researchers trained models to analyze these notes. They tested traditional tools like Random Forest, a decision-making algorithm that aggregates multiple votes for accuracy, and modern powerhouses like BERT, a language model that functions like a supercharged dictionary, understanding context and nuance. But here's the twist: Spanish grammar can be tricky. When a note just says patient, the AI used verb endings and other linguistic cues to infer gender, like solving a puzzle with just a few hints. The results? The best models achieved 96% accuracy, like hitting a bullseye every time. But the real breakthrough? Techniques like SMOTE, which generates synthetic data to balance rare cases, help the AI improve. And when they fine-tuned the models, like adjusting a car's engine, accuracy shot up even more. So what does this mean? Imagine a system that flags potential diagnoses so doctors can focus on what matters: building trust and tailoring treatments. AI isn't here to replace humans. It's here to amplify their expertise, especially in a field where time is tight. This isn't just about fancy algorithms. It's about making mental health care faster, fairer, and more accurate. By turning chaos into clarity, these tools could help spot patterns, predict crises, and ensure no one falls through the cracks. Ever wonder how AI is turning medical mysteries into clear answers? Let's break down the tools behind this revolution and why they're changing healthcare faster than ever. Traditional machine learning models like Random Forest or SVM are like the trusty wrenches of data science, great for straightforward tasks, but they hit limits when dealing with messy, complex data. Think of them as detectives who can solve a crime if all the clues are neatly laid out, but struggle when faced with a chaotic, real-world scenario. That's where deep learning steps in. Imagine a team of specialists, each focusing on a different piece of a puzzle. Deep learning models, like transformer-based systems or pre-trained language models, are trained on massive datasets, from doctor-patient chats to medical scans. They don't just follow rules, they learn to spot patterns humans might overlook. For example, a 2024 study used these models to analyze decades of clinical notes, teaching AI to recognize subtle language cues that could predict risks like violence against healthcare workers. It's like giving doctors a crystal ball, helping them spot dangers before they escalate. And it's not just about prediction. Take Parkinson's disease. Researchers combined SVM models with Bayesian optimization, a fancy way of fine-tuning parameters, like adjusting a recipe to get the perfect flavor. The result? More accurate diagnoses and treatments tailored to individual patients. But here's where things get truly exciting: natural language processing, or NLP. Tools like GPT and BERT are now decoding medical jargon, spotting depression in patient messages, or even translating clinical notes into actionable insights. Picture a system that scans a patient's written history and flags early signs of anxiety. No guesswork, just data-driven clarity. The applications? Limitless. AI is helping predict cancer recurrence from scans, guiding treatment choices, and even analyzing brain imaging to detect tumors. One 2023 study used decision trees on MRI data to classify brain tumors, proving AI can be a radiologist's best ally, catching details the human eye might miss. But here's the real takeaway: these tools aren't just about speed or numbers. They're about empathy. By automating repetitive tasks, AI frees up doctors to focus on what matters most: connecting with patients. It's not about replacing human judgment, it's about amplifying it. So next time you hear about AI in healthcare, remember, it's not magic. It's smart tools, trained on vast data, working alongside experts to turn complexity into clarity. And the best part? The future of medicine isn't just brighter, it's smarter. Thanks for watching. If you'd like to dive deeper into how AI is changing healthcare, hit subscribe. And drop a comment: what mental health challenges do you think AI could help solve? Let's keep the conversation going. Stay curious.